In today's Health Watch, it is called brain on fire disease.
Local 5's Connie Feldman explains what that is and how doctors are trying to help those who suffer from it.
Imagine being totally fine one day, then the next you're having hallucinations, seizures, memory loss, even trouble talking. It's called brain on fire disease. Here's the journey of one young woman who experienced this rare and mysterious illness. Hunting, mountain biking, horseback riding, you name it, Katie Miller would do it. Until she couldn't.
I just didn't feel like myself, like normal.
Katie said, "Mom, I feel like my brain snapped."
Local doctors admitted Katie into a psychiatric ward. But what was happening to Katie wasn't mental, it was physical.
What happens is you're perfectly normal one day, and suddenly overnight, this person can become paranoid, can start having visual hallucinations, auditory hallucinations.
Anti-NMDA receptor encephalitis, also known as brain on fire disease, is misdiagnosed as a psychiatric disorder in up to 40% of patients.
So for many of the females, especially after puberty, they can develop what's called an ovarian dermoid cyst or an ovarian teratoma.
These cysts often have hair and teeth in them. The immune system sees it as foreign and attacks. But
in these cysts, there is a component of tissue that really is brain tissue.
Within 4 days, Katie was catatonic and needed a ventilator to breathe. There is no single approved treatment. That's why a 5-year nationwide clinical trial is testing whether a drug called inebilizumab will stop the assault on the brain. Katie had her cysts removed. She can't remember 3 months of her life, but now, and with various medications, Katie is on her way to recovery. Up to 50% of patients can suffer long-term consequences, especially cognitive and mood symptoms, over months to years. If this disease sounds familiar, it could be because the book, Brain on Fire, was written by journalist Susanna Callahan, who had NMDA receptor encephalitis. It was made into a movie in 2016. And that's your Health Watch. I'm Connie Feldman, Local 5 News.
Thank you, Connie. Tomorrow in Health Watch, an abbreviated MRI, that is, to detect the tiniest breast cancer tumors.